Drug take-back. At the October 2015 board meeting, the board approved proposed text to add section 1776 at sequel to Title 16 of the California Code of Regulations related to drug take-back with specific modifications. The modified proposed text will be reviewed at the board meeting. This is now. Copy of the board approved language not yet noticed is provided in attachment 7. So that means that there will be a comment period in 45 days, I think.
If we move forward today.
If we move forward, yeah.
Now, at the last board meeting, I know we had a discussion the reason it's coming back here, because we did approve a 45-day at the last board meeting, was because there was some substantive changes that we requested be made to the definition of the liner. Is that right, Jenny?
You asked that we remove the hazardous liner requirements that were in the last version of the draft that we brought to the October board meeting and replace it with basically the equivalent of medical waste, which is the ASTM standard that's in there. You also asked that we build in a requirement for a rigid container to house the liner, so that it could be more readily moved and not have it so much like a trash bag that you pick up and something starts falling out of. So those provisions have been inserted in. The problem I had, and I recommended to the president that we bring this back to the board, was because I reordered some of the sections a little bit for continuity. My concern was it would be viewed as the EO's work product when we submitted it at the end of the day to OAL and not that of the board. So out of an abundance of caution, to use the FDA's phrasing, I suggested to Dr. Gutierrez that we bring it back for your review and approval, and then we'll see where we are. So that's what you have before you in the packet.
There also are a number of recommendations that I would like to provide to the board for consideration on these revised drafts. And Ramon, do you have a question?
Yeah, I just want to clarify. So where we're at here is that this is not any kind of a final deal, what we're looking at here today, that because the people who are really concerned with this haven't seen this and have had no opportunity to study or comment on it. So we're really just putting this, we're discussing it now, but in terms of action, putting the whole thing over so that all interested parties will get a shot at this.
No, I believe that the revised copy was posted, was publicly available on the website. What we're doing today is discussing any further changes. Then if we approve it and move forward, we'd have a 45-day public comment period so anybody could review and provide comment.
I heard it only went up a couple of days ago.
It went up Friday night when the
Friday night, right, for today. So the very end, the very beginning of a weekend, which is now ending today, that's not really good timing.
Yeah, and I don't think the changes were that significant in this last one.
No, there were some changes back in the back part of it, but not so much at the front. There's very few changes in it, actually, other than to do what I just said. We recast the standards for the liners and added a rigid container, and I think that was pretty much it.
And I mean, the point is, the 45-day comment period would start now. So anyone who might want to comment on it will be able to review it for 45 days. So.
Right, that's the important thing. Is that, I don't want to quibble about the weekend business, though it would be nice if things got put up a little sooner than that.
We agree.
Okay.
We absolutely agree. In this particular case, though, I think that we've had basically a draft version of this reg on the board's agenda for a year now. It's time for us to move it. Again, this one's been languishing too. We need to move the regulation and go through the formal notice period. That way the comments that are made become part of the permanent record for the drug take-back.
Right. Well, the other thing before we move too fast is that I am going to discuss what the impact of this is on San Luis Obispo County, because I think that's a fairly major consideration. I was not present at the last meeting where this was discussed, so I am going to want to make a few comments today.
Thanks,
I
Ramon.
just have a question. So this, what we have in the blue is what was noticed. And then this
is just, I am just going to propose some changes that I'd like to bring before the board, but I put them in this handout so that you could see them a little easier than my just saying them verbally. So I'm going to be going over my recommendations on this white copy.
So to answer your question, Debbie, you're correct. The white version was not noticed, not been noticed.
So our audience
any changes that would be made pursuant to this would be noticed, be part of the notice for the 45-day period. So a new version would go up saying this is now subject to 45-day comment.
And the proposals that Dr. Gutierrez has recommended, I believe, are going to go up on the,
Whenever you would like them to, we'll have them put up.
Yeah, we'll bring them up.
Okay.
And we have gotten a couple of comments from some of the counties that are impacted, and we'd like to be sensitive to the fact, and I think we're all on the same page, because as soon as we get these regulations out, the sooner that pharmaceutical take-back can occur. Because there are some pharmacies that are waiting for these take-back regulations to be finalized before they start doing take-back. So I think everyone's on the same page to try to get this moving forward. So one of the things that and you're bringing this up right now.
Before we get too much further, there were a few people who couldn't be here in person to provide their comments. I'm going to hand them out to the board. They asked me to do that, and they're in the back of the room for the public as well.
Thank you.
Amy, and nowhere this proposal that's a mandatory require now, isn't it?
Well, we'll talk about that, because actually what's one of the discussion points that I wanted to raise in terms of what the voluntary aspect of drug take-back is. And that's actually on the first page when we're talking about 1776.1, where it says pharmacies may assist under A, Section A. Pharmacies may assist patients seeking to destroy unwanted, previously dispensed prescription drugs as provided in this article. Provision of such services is voluntary. And then I'd like to recommend that we add as described in 1776.3A, which refers to the take-back bin. The concern that the way it was phrased before is that anything having to do drug take-back is voluntary. So if a county wants to put in a process that all pharmacies must educate their patients on how to return or dispose of drugs, or they need to provide out envelopes, that I don't believe is a public safety risk for the board in terms of it being voluntary or not. The issue in the voluntary, I believe, is that we had actually talked about was the actual pharmaceutical waste container being in a pharmacy. So I just recommend that we add that just to delineate further what we actually consider voluntary.
And I would not be in agreement with that.
Okay. So you believe...
I saw Ramon actually put his hand up and I spoke, so Ramon, I'll let you follow the
All right,
correct
thank you.
order.
Well, like looking at the comments that we just got from a representative of the County of Santa Cruz, where they ask that we make it clear that what we mean by voluntary is where it is voluntary, that we are not preempting local laws. They specifically ask that we add the phrase unless required by local, state, or federal law, except really just be unless required by local law. This is a handout that we were just given about 1 minute ago.
I think
So he
what this
put-
is saying is it's saying that it's voluntary unless local ordinance, local, state, or federal law requires it.
It's going to get back to who's in, who's watching the store, I guess, as the old joke goes. How much should an entity other than the pharmacy board be allowed to regulate what happens in a pharmacy?
Well, I agree with you 100%, Stan. I think that's why, trying to give the state or the local groups the ability to mandate something that happens in a pharmacy makes me really nervous. And I think the reason I don't even like just saying it's the bin. Then we're going to have all of the local groups say, okay, we'll do mail-back programs. I know the board's not supposed to be about the business, but that's not putting the stakeholders, I think, in a good situation, because the mail-back program is very expensive for a pharmacy. And so, so basically what we're saying is, okay, we're going to put handcuffs on not handcuffs, we're going to let the pharmacies figure out the receptacles, but if a city wants to mandate the mail-back packages, then they can. And I feel like we're what's the right word? We're making it not good for the pharmacies. We're penalizing the individual, the pharmacies.
But our role is public protection. So how is our listing that, our basically taking a stand on those mail-back envelopes in the role of public protection?
Because mail-back packages, at least the way a couple of the counties have it, is that the pharmacy has to offer it. So that's part of the consultation portion. So you know, not only do you have to make sure you counsel, but you also have to make sure you're offering the mail-back things. Granted, you know, public protection, decreasing the viability of a pharmacy isn't, I guess, really our realm, but I think it is something we do need to take in consideration. I think it's an unfair tax that we're putting on the pharmacies.
I think it sends the wrong message to the patient. I'm sorry, go right ahead, Ramon.
Thank you very much. Well, we already have counties that are regulating what pharmacies do. This is already what Alameda County is doing. Los Angeles County is considering a resolution on this next month. This is something San Luis Obispo County has already done. I think before we start deciding that we can preempt counties like this, we ought to get some clear legal advice, because I did observe the meeting that occurred last time this was discussed. I feel that we got no clear direction from council as to what the rights of this board are vis-a-vis county boards of supervisors. I think that ought to be cleared up, because I can tell you, having at least talked it over with the person that, or the office that appointed me, the Senate Pro Tem's office, it's not clear to the legislature that this board has that kind of authority. It seems like we're trying to be the legislature in this case, and I think we've gotten ourselves out of bounds. And if I'm wrong, I would like a clear opinion from council as to what our prerogatives are before we start getting ourselves into this kind of a mess. Because if we are wrong and we do something we don't have the authority to do, I don't know why we aren't going to end up getting sued, investigated, or something else. I really think we need to get some clear legal opinion about what we can do here.
Ramon, and I appreciate your point, but I think our role as the State Board of Pharmacy is to review what is safe for patients and what can we do to protect public. That's what we're here for, is to a public protection role. And if we believe that there are some regulations that'll make this process safer, we need to implement those with that public protection mode in mind. Whether or not, whatever the local ordinance does, we need to regulate, we're here to regulate pharmacies and what pharmacies can and can't do. So I see this as, if you're going to have a bin, these are the things you really need to have in place so that it's safe for not only the pharmacists, but also the consumers that walk into that store. So that's what I think the focus of our regulations is on doing our role for public protection.
I agree with everything you just said. If that's what we're doing, that's great. But when we come over the line and we say that county ordinance to require take-back is something that we're going to preempt, I think that's where we've crossed the line.
I don't think that's currently in our regulations at all. There's nothing in here that I saw that had any preemption language.
Well, listening to what Stan and Debbie just both said, I think that's how they understand it. And I think we're creating an ambiguity here that is going to be very problematic for this board.
That's not, I don't think I implied that.
Well, maybe I'm wrong. I mean, then we should clarify, because all that was asked here is we put in it's voluntary unless required by local law.
I think, and Stan, I don't mean to speak over you, but I think what our point was that if we put unless required by local law, then we're allowing the state and local folks to provide pharmacy regulations, to govern what happens in a pharmacy. And what I don't want to happen is to have a county or state, a municipality tell a pharmacy how to practice pharmacy. And so anything that purviews that, like Amy said, and I think we're all on the same page as far as, you know, customer protection, consumer protection, but I don't think we should then say, unless a city or a state say something else. I think the Board of Pharmacy is the Board of Pharmacy.
And so let's say that in following what you stated, unless required by local law, what if the local law says you're going to put a protection bin on the street outside your pharmacy? And our regulations state that you can't do that. So we're going to be placing these pharmacies in a really sticky situation on who are they going to follow.
Well, rather than dance around the wording, okay, what we're talking about is San Luis Obispo County, and can that ordinance stand? And I think we need to be clear on that. There's an ordinance in that county that says all pharmacies have to either give out envelopes or have a receptacle. And it makes perfect sense to me that we say what that receptacle should be and how it should operate. That all makes perfect sense to me. But, you know, without parsing words, what we're coming down to is, can we preempt that ordinance in San Luis Obispo County, yes or no?
Well, I don't, San Luis Obispo is not the issue for me. The issue for me is consumer protection. I want the pharmacists and I want the pharmacy staff to focus on giving the best public health advice, the best health care advice they can give to their patients. That's where I want the focus. I want consultation. I want these people to be able to spend time with their patients. I want the patient to walk out knowing everything that they should know about the bottle that they have in hand that they're going to take and use to the benefit of their good health. That's where I want the focus to be in a pharmacy. I don't believe that some of the other things that go on in a pharmacy with the expectation of a pharmacist's responsibilities are appropriate for a pharmacist. It dilutes the time that the pharmacist should spend with the patient. And this is just another example. I think the focus should be on the patient getting a bottle of meds to take. I don't think that the responsibility of a pharmacist, if the pharmacist decides that he or she doesn't want the responsibility, should be to deal with trash, the taking back trash.
Well, I don't think opioids are just trash, and that's what we're talking about here, is where we're going to put the opioids. And I think that we do have a responsibility to see that the pharmacies deal with that, or at least not get in the way of counties that are making sure that that happens. And it's not a big time consumption thing anyway. I went to a pharmacy in San Francisco. I met with the chief pharmacist. He's got the take-back bin there already. I asked him, so how much time does this thing take? He said, probably about 20 minutes a week. You know, explaining to patients, see that thing over there, you've got to put your drugs in there, don't put your garbage in there. And you know, he's got to, I think bi-weekly, he's got to take the bag out, and, you know, there's a double key situation. The person that's picking it up and the pharmacist both open the box, and then out comes the bag, you know, is prescribed, and then that goes to the dump, or, you know, however they dispose of it. But it's not a huge time problem in the pharmacy, as I understand it, to take responsibility for that. And I think it's very important from the point of view of public safety that we do have a good system for taking care of unused drugs, because right now we've got floods of unused drugs. The opioid epidemic, it turns out, is actually getting worse. Even after we've had the subcommittee and we've, you know, all the boards, the medical board, everybody else has supposedly, you know, made the situation better, we now get the latest numbers from the CDC that the death rate due to opioids is going up. And, you know, I think that's one of the major things we need to deal with here. And I'm all with what you're saying, Stan, about, you know, safety and the pharmacist doing the right thing and not being hassled by too many unnecessary rules. I think having some prerogative to tell the pharmacies to take back the drugs is not going over the top in terms of what the, you know, the safety factor is of getting those drugs properly disposed of. I still do think it comes down to, you know, San Luis Obispo County, and can they do this or not? I think that we need to be clear.
Ramon, I believe that in San Luis Obispo County they can, because if we basically state in here that provision of a take-back bin is voluntary, there are other ways to do drug take-back besides just voluntary. That's why I'm of the opinion that we should just make the pharmaceutical take-back bin that, and if you go on to the other language I'm recommending in here, is if the pharmacist in charge believes that they can, in public safety, in terms of maintaining public safety and meeting all the regulations we require, they believe that it's okay and they have the ability to do it, then it should be on a voluntary basis. But a pharmacist in charge who's responsible for these regulations shouldn't be forced to put a bin in his pharmacy if he or she does not believe that they can safely maintain that bin. There are other ways of doing drug take-back besides just having a bin in a pharmacy.
Right,
So
San Luis Obispo doesn't, excuse me. They don't require that it be a bin. They require that it be a bin or an envelope.
Correct. So then the
And I think that's good.
pharmacies that can't do that particular bin and they don't feel that it's safe and they don't, maybe they're on probation. I mean, we have something in here that if a pharmacy's on probation, they cannot do drug take back.
Right.
So if there's a reason why they can't and they can't do it safely, the envelope's the other option. Now, I've looked at San Luis Obispo's ordinance, and I don't know if they're here, but I would have concerns on how that ordinance is written. Because if you read it, the reason, and I think that's the problem that the pharmacies are having with the envelopes in that county, is that when I go pick up a medication at a pharmacy, the pharmacy's required to provide me an envelope. If I'm picking up a prescription for antibiotics, hey, I'm going to take I don't need the envelope at that point in time. I may need it a year from now when I'm actually looking to go dispose of medication, and where's that bin? It's probably in the trash bin somewhere. So the timing and the way that's written is probably one of the reasons why a lot of the retail pharmacy chains will say that they give out envelopes and they're tracking it. And I heard something like 8 out of every 100 envelopes actually makes it to the reverse distributor. It may just be the process that it's been worked on. So I'm not saying that that's the only answer, but I believe that I strongly believe that the take-back bin should be voluntary. I actually don't agree with Debbie. I don't think we should have a role on the whole issue of the envelopes, because that is, I think, a local issue for discussion. But I don't believe we have a public safety role in saying that giving out envelopes is a public safety hazard or is not in public protection.
Right. So, well, you're a good patient because you take all your antibiotics.
I do.
Unfortunately, a lot of people don't. You know, as soon as the symptoms clear up, they stop taking their pills. We all know about this. Those people probably could use the envelopes. And frankly, if 8 out of the 100 turn up with the pills, I think that's good. That's at least 8 out of 100 pills that got into disposal.
They might put that envelope in some drawer somewhere, and they may not even think about it until they go later to go dispose of the medication. Then they're like, where's that envelope?
Right, but if we increase the number of taken back drugs by 8%, I think that's great.
But, you know, I know we don't, and I'm sorry, but I know we don't want to talk about the economics of it. And so I would think 8 out of 100, I'd probably be okay. Except my pharmacy had to pay for all 100 of those envelopes.
Yep.
And it's at about $5 a shot. So I had to pay for every time I handed an envelope that Amy throws away, I just threw away $5 that maybe I could spend better.
But Debbie, I think that's the way that ordinance was written, because if it was written differently, where it would be offered upon request, or if somebody walked in with the drugs in their hand, it would be done a little differently. So I don't think that that ordinance necessarily is the way that all the ordinances are going to be. In San Francisco, for example, I know it's voluntary. So pharmacies participate on a voluntary basis. So it's not always that way. And I think San Luis Obispo is not a great example.
So the pharmacy, but San Francisco, it's voluntary all around. It's not voluntary receptacles, mandatory mail. It's just, why wouldn't you just have an all-around voluntary program?
I believe they have a funding, they're working on a funding source, or they have a funding source similar to what
Regardless
Alameda
of the
County.
funding, why wouldn't you have it voluntary all around and let the pharmacy, if they want to participate, pick the best method for them?
Victor.
Isn't the, oh.
Yeah.
Go ahead.
Amy, I know opioid overdose abuse is a big problem, but you can't blame it just because the pharmacy don't have a take-back program. I believe the pharmacy board is doing the right thing now that we have a procedure regulations in place to set the guidelines for the pharmacists. And we're doing exactly the right thing, but you can't expect or speculate what the other cities would do. So I go ahead and put it as a voluntary. If the city they have other things imposed on us, let them handle it at that time. But right now, this is a thing we need to do and just go forward with it.
Amy?
Yes, Greg.
It would seem to me that, you know, this would be a marketing thing also, because it would seem to me that if I'm a pharmacy and I'm offering to take back drugs, I'm going to get more people in my door to buy.
Now, let me ask Albert, because you're in Alameda, right? How does it work?
What I'm saying is, if you leave it voluntary and they
The one in Alameda, we...
come out with it.
I'm sorry. Go ahead.
I'm just saying, if you leave it voluntary, it seems to me that those who choose to do it are going to benefit, so.
The one we have in Alameda County is that in my neighborhood, they have one at East Bay Mud Building. And then the patient just go in, drop it in, and I think they have federal building and maybe some police department or fire department. But it's voluntary. I mean, I'd like to know on the St. Louis Obispo, is that, I mean, Debbie said the envelopes cost $5. Who's paying for it? So the pharmacy pay for it? Now, how can the pharmacy could afford to paying for those envelopes? I mean, you don't make $5 each prescription you fill. Exactly. You lose money. I mean, you talk about paying another $5. You think those pharmacies continue to exist?
Right. So that's why I'm worried about making the envelopes a potential mandatory option if we make receptacles voluntary.
And Greg,
Look, I'm not saying make the envelopes mandatory.
No, but Amy, that's what's going to end up happening. If you make it the receptacles voluntary, then the envelopes could be mandatory.
Greg, sure. It's not a good marketing strategy for pharmacy. You know what? It's a very good strategy actually for attracting the drug addicts knowing that somebody's going to throw it back there. You know why? Because last week in Alhambra alone, we have 2 pharmacies got burglarized by the addicts because they came in and they took all the Finnegan with codeine and Norco.
Did they have
My
take-back
pharmacy got
bins?
hit too, but they just broke the glass. They couldn't get in because
Right.
I have really strong bars behind it. So if they know that you have a receptacle right there, knowing somebody's going to put in some Norco, good strategy. I mean, no, I don't think so. You attract more people to come to my pharmacy.
Good,
Burglarize.
2 points.
good point.
One, I actually agreed with the end of Victor's comment before, which is let the localities do what they want to do here, because that's what I think we should be doing. But I really want to point this at our council. Hello? We need a definitive opinion, because first off, I don't see where we have the authority to preempt a county ordinance like this, and I would like a clear legal opinion as to that point before we even get into whether or not the county's ordinance is one we like or not.
Well, as another
Not sure what-
as another question on the same point there, only a little bit different. If we make something voluntary, I'm not sure that that would preempt a county from making it mandatory. Would it?
Okay, so I will, I'll answer the questions as presented,
Okay.
in the order in which they were presented. So, to unpack Dr. Casablanc's question, there's 2 questions. There's one, does the board have the authority to promulgate this regulation? To me, that seems clear. This is related to the regulation of pharmaceuticals, which is within the purview of the board. So the board clearly has authority to regulate how pharmacies, its licensees, participate in drug take-back programs. The regulation is within the regulatory authority of the board. That's a very different question than whether the board's it's not a question of whether the board has the authority to preempt. It's a question of whether the board's regulation duly promulgated will have a potential preemptive effect on local ordinances. And that is a very unanswerable question, because preemption is not a simple yes or no, black or white question in that way. What is clear is that state legislation that in this area would have a preemptive effect, and it is clear that some regulations can also, some statewide regulations, particularly federal regulations, but particularly some statewide regulations can have a preemptive effect. But it's not at all clear whether a regulation of this type would have a preemptive effect. I'm sorry, there's just no clear answer. So I think the board should
Well,
make
you
a
gave them a
decision.
clear answer.
I think the
Why
board
can't
should
you
make,
give me one?
notwithstanding what the impact might be, I think the board should do whatever it does consciously and with its eyes wide open. If it's the board's intention to preempt or not allow local ordinances to make take-back programs mandatory, to essentially impose its will, then I think the board should state that clearly. If it's not the board's intention to do so, but if it's to say that what we are describing is a voluntary program, but that doesn't preempt local ordinances that make it mandatory, then I think the board should state that clearly. I don't think that that will necessarily control whether it's in fact determined to be preemptive, because it's not clear under California law whether regulations of this type can be preemptive. I think it's I think it's a 50-50 proposition whether it would in fact preempt.
And for what it's worth, I very much concur in that. I do believe that the board has the authority to adopt this regulation as it's prepared for the reasons that you've talked about relating to consumer protection. You have the authority to regulate pharmacies. This is your regulation of those pharmacies. And I also completely concur with Josh in that while there is very possibly a preemption effect that could occur, there is no clear area of law.
So it would have to go to the courts to determine?
And it will probably end up before a court at some point. So my advice to the board is to focus on that consumer protection aspect and decide what you think is, on balance of the impact to the consumer, and decide what you think is best for them.
Dan?
Is not the federal law voluntary?
The federal law is voluntary but not preemptive. So in other words, this federal statute says that the regulations to be promulgated on drug take-back for controlled substances may not make it mandatory. That is different than saying that the program has to be voluntary, and therefore, if it had said that, and if it said it in such a way that it met various other preemption requirements, that might have been preemptive enough to make it voluntary everywhere. Although again, preemption is a very, it's a 7-step analysis. I mean, there's all kinds of things that could decide that it wasn't preemptive, even if that was their intent to preempt. But the point is, the feds made no attempt to preempt on the question of voluntary versus mandatory. All they said is that their own the DEA regulations on controlled substance drug take-back cannot make them mandatory.
Well, it sounds like we've got some decisions then to say, you're recommending we either say we're going to that we preempt that it's voluntary or it's not, basically from a preemptive standpoint.
Right. Well, I mean,
we should.
The most important thing is if you don't intend to preempt, that you say that. Because that is the clearest way to make it non-preemptive. And it's not been clear to me from the board's discussion whether all of you are on the same page on that. Some of you, I think, have said, well, if we don't say anything, then that shouldn't impact local ordinances. Well, I think if that's in fact your intention to not impair or impact local ordinances, then I think you should so state. Saying that you want to make it preemptive is sort of duplicative and unnecessary, but I mean, it wouldn't hurt for you to also say that.
Well,
I guess that's the first issue. And then once we resolve that, then our focus should be on, if you're going to do this, this is what the regulations you need to follow to protect the public.
Right. I mean, I think given that there are, I don't know how many counties there are, 3 counties that have programs? And I think only one of them is mandatory, or is there more than one that's mandatory?
I think there's another one that's coming up to be mandatory, so there'll be a second.
Okay, so, but even given that there are at least 1 and maybe 2 counties that are mandatory, I don't think the board can regulate in this area without confronting the issue of whether they are going to, disallow those mandatory programs if in favor of a voluntary program.
What's the second county?
Santa Cruz.
Okay. Oh, that's why we got the letter from Santa Cruz. Okay. Who is he a supervisor? I'm sorry to be ignorant. Oh, we can look it up. I could Google the guy and figure out who he is.
Yeah, I think he's a supervisor.
I looked him up, and he's
Yeah.
He's a county supervisor.
He's former Department of Public Waste. I'm not sure if he has a current office with the
All
county.
right.
I'm trying to look him
I'll
up.
Google him too, and we'll see who the guy is. But, I mean, that's probably another board of supervisors coming at us, and we've already got one. And so I think the advice that we make it clear where we're going on this is good legal advice. If we want or don't want to preempt, let's say so, and let's not be vague, because the way I heard the discussion the last time, it wasn't clear at all where the board was going, and to just sort of pass a muddy resolution and then see what the heck happens, I don't think is very responsible, given especially the fact that, as our counsel has already said, a lawsuit is in, the wings if something like this happens. And I would add, I think possibly a legislative investigation. So I think we should be very careful and clear as to what we're doing here.
Well, not to disagree with you, Ramon, because on rare occasions I do, and so, but I thought it was quite clear at our last meeting that that the boards felt that it should be voluntary and not mandatory with regards to take-back programs, that they shouldn't dictate, that we as a board shouldn't dictate a program where we would be taking assets away from the pharmacist, that hopefully with the assets that would be used to the benefit of the patient. But aside from all of that, precedent. So is precedent come into play here at all? I mean, we have this one county that now has an ordinance in place, and is that precedent enough?
I mean, was it grandfathered in? No.
Okay.
No, it's either preempted or it's not, and that's determined not by who was first in time.
Okay.
And just
Thank you.
as an aside as well, I think by suggesting that some litigation may resolve this, that doesn't necessarily mean the board would be a party to that litigation. Because if you set your reg, it may be a particular location facility within the jurisdiction of that county or something like that. The board might not be involved in the litigation at all, except mentioned. So I don't mean to suggest that the board itself is
I don't
going
know
to
what
be
I
sued.
Who would be involved?
So I think we need to think about this. I mean, how many of us feel very strongly that both are equivalent? I mean, do we believe drug take-back bins and envelopes are the same? Should we make both of those, are they same, they have same public protection risks? The envelopes and the take-back bins, are we going to lump those together as saying that those have equivalent risk and they should all be voluntary?
Well, I,
Feel that way strongly. I mean, because if so, then we're just going to lump them in and make it one.
I think that they should be however we want to handle them, I think they should be handled the same way.
I have heartburn about, you give somebody with limited understanding for language and about medicine, prescriptions, and you give them a bottle of meds, and then you give them at the same time a container
Yes.
to send the meds back with. And I can see, when we had that review about labels, it says 1 twice a day, how do you take it? And all over the board, there were almost unbelievable responses. It's clear that there is so much medical illiteracy out there for whatever reason, but it's there. And so you give somebody a bottle and a container.
Stan,
to send it
that's-
back. I could
that's-
see him going home, putting the thing
but
in
that's-
and dropping it in the mailbox.
But Stan, that's that's how one county handles it. I am of the opinion that's not the best way, because I don't believe handing it out at the time that you hand out a drug, it's already telling the patient you're not taking your meds. I mean, that's already there.
That's another thing.
So
Compliance is
I
out the
believe
window
that the
on that.
procedure in that process is not right. So if it were where the patient walks in with some drugs in their hand and then you gave them an envelope, would you feel differently?
I don't think we want them walking in with Medicaid. Or hand if there isn't a bin there.
Amy,
Yes.
by mandate the take back by all the pharmacy, independent pharmacy, we create undue hardship for us. I mean, I'm a little pharmacy, I have to handle a locked receptacle and passing off, giving $5 per envelope. We can't afford that. I mean, you're driving us crazy. Why should we mandate stuff like this? I mean, you're giving me money, you can mandate, fine, but you mandate me to give you money. That's impossible. I'm strongly opposed to it.
Just lump them together. Keep it together.
well,
Alan
Amy, I didn't.
and Albert, you guys have been pretty quiet over there. And Ricardo, what do you?
Amy, I didn't understand your question, actually. I'm sorry. You were
My
talking about.
question is we're talking about voluntary. Okay,
Yeah.
we're going to take a stand on voluntary. Do we believe that the whole thing should be voluntary, or do we believe that the voluntary part is to have a take-back bin physically in your pharmacy?
Well, I don't believe either one should be mandatory or should be voluntary. However, that's not something we're voting on right now. What we're voting on, as I understand it, the key is what San Luis Obispo County is doing, and are we trying to overrule their policy? To me, that's what we're voting on here.
I don't think we're voting on it all.
Voluntary or not.
Yeah, but the
Alan
upshot
and-
is to overrule their policy, unless we make it clear that's not what we want to do.
Well, I'd like to hear from some of the silent, Alan, Albert, Ricardo.
Well, I think Victor speak my mind. I mean, with the hardship that the community pharmacy, maybe the CVS have the deep pocket, but how can the community pharmacy could afford it? Now, I mean, I've been bitching about the reimbursement all along. I just noticed that since January 1st, Aetna insurance been cutting back so much. I mean, when you fill a prescription, it's a point of sale. It say that you make so and so, so and so, and most of the time it's very little anyway. But right now, you don't even know that's what you're really making. And then after, 2 or 3 months later, or a few weeks later, then they give you the reimbursement. Then that's a true reimbursement. And by that time, it's too late. You already lost a lot of money already. So, I mean, it's very hard as the way it is all out there. And it's so dramatically cut back, you cannot believe it. I mean, like I said, when you come to work, you make a few bucks. When you sell a cup of coffee, you make a little bit. But when you fill a prescription, you're paying your boss. Just imagine you going to work and you pay the boss. And that's what the community pharmacy is facing. So, I mean, you try to tell me that each patient come in, I got to get paid for an envelope $5. I don't even make $5. So how can it possible? So it's,
But Albert, in Alameda County, it's my understanding that they have an ordinance that allows the pharmaceutical manufacturers or requires them to pay. So you're
The
saying.
manufacturer to pay,
So are
but
the
not the
manufacturers-
pharmacist.
So in Alameda County, the manufacturers are paying for these?
I think, yeah, I think that in order for them to participate,
Okay.
they have to pay in to the pot to take care of those problems,
Okay.
but not the community pharmacy themselves.
Alan?
There's somebody out there that looks like they know what they're talking
Yeah.
about. Maybe we should have them speak.
Alan, is that not you? On your microphone, press tilt.
Anborn with the California Product Stewardship Council. And I was going to
Afternoon.
say,
California what?
Product Stewardship Council.
Good.
And we've testified on this issue before. And just to clarify, there's two kinds of ordinances. There's one that's mandatory retail takeback, and that could be that the pharmacy, as is required in San Luis Obispo, is required to pay. Then there's the producer responsibility ordinances such as Alameda's and Santa Cruz's. And even though Santa Cruz mandated that retailers take it back, they are not paying. It's an apples and oranges situation. As far as and I know you didn't want to talk about the money, but at the root of it, it's all about the money. Who's paying? So I just wanted to make sure that was clear.
The $5 an envelope number, is that what?
That's approximately correct, yes.
And the problem in at least, and this is, correct me if I'm wrong, in San Luis Obispo County, if I go get a prescription filled, I'm required to offer that to everyone who comes in, because I was reading the ordinance. So every time someone gets a prescription filled, they're offered, hey, do you want an envelope just in case you want to throw this away?
And Bill isn't here, so I don't know if that's exactly how he wrote
Yeah,
the
'cause I
ordinance.
actually
but
read the actual physical ordinance, and I was concerned because that language would be, because I had heard the retailers saying that only 8 out of every 100 envelopes is actually returned to the reverse distributor.
Well, and I know San Francisco tried to do this with their envelope program. And they had very low returns as well, and they couldn't afford the program. So this gets back to who pays and why a lot of counties are going with the manufacturers pay, because they can't afford it. But when the manufacturers set it up in Mexico and Colombia and Brazil and most of Europe and Canada, it's always done in pharmacies and bins, because that's the way most people can go there and access it if they're handicapped, and it's the most cost-effective way to get the most stuff back. That's just the way they've set up the programs. We don't have to do that here, but that is typically what everybody has found to be the case, which is why they go that route. And again, if the pharmacist is not paying for the bin or paying for disposal and getting free advertising, they often voluntarily want to host the bin.
I just feel that it ought to be a voluntary program. It could very well be that cost isn't an issue as far as the bin is concerned, let's say in the middle of the pharmacy or wherever you would put it. I had stores that were maybe 400 or 500 square feet. It's 1,000 square feet. I think the average store I had was about 1,100 square feet. You take one of those bins and put it in the middle of one of my stores, and that is a significant piece of furniture or something in the middle of this store, which people are climbing around.
Well,
So my point being that it's in some places it is absolutely not practical.
Well, the assumption is that all bins are the same size, and that's actually not true. There are some bins that are actually tabletop size, and then there's oftentimes they'll put them behind the desk at the pharmacy and just put them back in
Well,
that way.
when we talk about a bin in this reg, we're talking about something, to me, that is substantial and is well protected. There's a lot of security around it. So
And I don't think we want to have a bin behind the pharmacy counter, for
No.
sure.
I'm just saying there's different, I didn't want
Right.
the assumption being there's only one size of bin, I guess.
But it's just,
I looked over at Ginny when she said that. I'm thinking, do you want to make some comments about that?
well, it's just, and that's why I feel strongly that in one of my pharmacies, our focus was take care of the patient. The patient is your primary concern. Dispensing the meds and the patient is your primary concern. This is contrary to what I think a pharmacist should be doing.
I've talked to a lot of pharmacists who actually tell me they're terrified to not take the pills when people come because they know that they're getting dementia and they're afraid they're going to mix their medicines up. So for them, it is a public health issue to be the collection location. If I could just say a couple of things. you know, this whole thing about,
Clarify, do you think it should be mandated or voluntary?
we've always supported voluntary because we don't think it needs to be mandated. However, we're very concerned that when the counties have primary public, well, I shouldn't say primary. I'm not a lawyer, but the counties do have public health and safety responsibilities. And in fact, that's why Alameda took it all the way to the U.S. Supreme Court against pharma, because they believed they had the number one, they needed to protect public health and safety. Nobody else was doing it, and therefore they took it to court. They defended themselves. So that, you know, they have a right too, and I'm not a lawyer. I don't know where those lines cross. That's up to you guys to decide. But I think it's just treading on very delicate ground. As you know, it's kind of holy ground to local governments to be able to mandate what they feel is important to protect their public health and safety. So I hope that you know, think this through very carefully, because and I know you are, and that's what this whole debate is about, because the counties really want to have all the tools in their toolbox until there is a sustainably funded system that works, it's well publicly educated, you know, throughout the state. The public is very confused. We just did another survey this week in Alameda, got 500 responses back, and most people don't have a clue. Their pharmacists and their doctors don't know what to tell them, and they're very frustrated. And we do have an epidemic of drug abuse, so they want these things out of the house safely.
Well, Heidi, I know Alameda's funded by the manufacturers. Is San Francisco as well?
Yes, all of the others are. So it was Alameda first, and King County, Washington passed it in 2013. Then it was San Francisco, San Mateo, Santa Clara.
And I know Los Angeles
Then
County is
Marin,
working on that
and then
now.
Santa Cruz added Sharps to it. So they're doing Sharps and meds, and they added the mandatory retail component. And now LA is considering, as you know, next month on the 16th, and that so far is voluntary retail take back. We support that. We think that you will have, and we agree, some pharmacies are just small, or maybe they're being, you know, they've got a problem and you don't want them to be the ones to collect.
All those counties you mentioned, are they all voluntary?
Yes.
Okay, so they all have voluntary.
Except for Santa Cruz.
Okay, except for Santa Cruz and San Luis Obispo.
Yes, but for Sharps, we have City of Sacramento, San Luis Obispo, all of Tulare County, and most recently the City of Galt mandated the pharmacies pay to take back the needles.
So for drugs, though, since that's what we're really focusing on here is the pharmaceuticals, all of those counties pretty much are voluntary.
Correct.
So there shouldn't be a problem with us including voluntary in our regulations.
No, I think the counties will see it as a problem.
They will?
Yes.
Even though they're voluntary?
Yep. They don't, I don't, this will be between you and them as to whether they feel that it's okay for you to take that right away from them. You know, I think that's what it's going to come
They
down to.
understand that from our viewpoint that they're putting in rules, regulations around the practice of pharmacy, and so we're kind of uncomfortable with them mandate. You know, we have all kinds of regs about what you do in a pharmacy, and now they're overlaying what our regs and saying, yeah, everything that they say and this program. And so I think that's, you know, I think Stan's done a good job of saying, you know, our focus is patient safety and getting the right medication to the right person,
Right.
making sure they understand how to take it. That's number one.
And to the counties, the number one thing for them is public health and safety too, and they see pharmacies as the people distributing all the drugs and the safest place to have them returned. So I think everybody's got good intentions. It's just a matter of where are the lines drawn on the regulation, and that really is between this board and the counties, and I think maybe a conversation with the Association of Counties and the League of Cities might be prudent, so that hopefully there is
Idea.
no court situation or
That's
questions.
a good idea, Heidi, actually really
Yeah,
is.
maybe we should encourage them actually to come to the board meeting.
We may have them here today.
But we would encourage you to proceed with the regulations, because as was discussed, this is a
Right.
timely issue, and if we have 45-day comment period, everybody can get their bite at the apple. Yes,
back.
yes.
We're still not allowed to take controlled substances, is that true? Or we can
Well,
take them now?
at any
Yeah,
Spain
we
Mud
can.
type facility, no. At any of the other facilities outside of pharmacies, hospitals with pharmacies, no.
If you're a DEA
law enforcement.
registrant, you can.
Yeah, you have to register with the DEA. We don't have any requirements yet. They can do it under the DEA requirements, and because those requirements are out there. But they have to register with the DEA as a
The
collector.
problem you have, Ellen, is that the patients don't know what's controlled and what's
That's what
not.
I'm gonna say.
Well, why don't
So
we- why
you-
don't-
you're- you
Nobody
have,
got their control. They got dump whatever they.
yeah,
feel
you
like
have,
dumping
you
in there.
actually have to be able to do controlled substance, because you could have something
As
there and not
the,
know it.
as the chair, I'm recommending we move it now and go into the 45-day comment period.
Before we go into that, can I review some of the additional, because we haven't really gone in to the recommendations that I had for this regulation. If we could do that, I promise it's not going to be much longer. Did you have anything else, Heidi?
I
Okay,
got that
thank
as a
you.
promise.
Okay, going on to collection receptacles and pharmacies, which is 1776.3.
So I see there's some changes in between. Are those yours?
Yeah,
Are those
just, you know what, the other ones, the change in between, don't worry about the one on page 2 of 10, because Jenny clarified that SNFs can't return drugs back to the pharmacy.
Right.
So disregard that
But there's
one.
other changes and those aren't yours. Like per current state regulatory requirements.
I think,
That yours 3.
yeah, do we need to put that one in there under
I'm sorry.
number
we're-
3? A
Actually, the
pharmacy-
DEA requires reporting within 1 day.
No, per current state. Okay, so let's
Okay, so
remove,
that's the- so
just
that's-
ignore all the ones up until 1776.3, which basically says placement, now this is, I'm talking here about it, placement of a collection receptacle within a licensed pharmacy for take-back services to the public is voluntary. Whether we keep the other voluntary or not is not at discussion here. We're just talking about the collection receptacles. And the pharmacist in charge may refuse the installation or operation of a collection receptacle if in the exercise of his or her professional judgment, a collection receptacle cannot be operated in compliance with the article or in a safe manner for public health. And I think that goes to the comments that Stan made about making sure that the pharmacy is ready. And that, what do you think about having a PIC be the determining factor for that?
Amy, can I ask a clarifying question? Are you, when you say don't worry about the other voluntary, are you saying that this voluntary would replace the voluntary in
Well, that's still open for
1776.1A? Okay.
That's still open for discussion. I'm just saying if you're going to do a receptacle bin,
Okay.
because this wouldn't apply to the envelopes
Okay.
about the PIC part.
But you don't mean to say that this will yet eliminate the fact that the whole thing is voluntary at this
No,
point?
because
Okay.
we could go back to 1776.1A and remove what I basically put in as described in
Right, okay.
1766.
That's why, I want to make sure that's what you
So if you do that,
intended.
then you just start this section with pharmacist in charge.
Yep.
Did it again?
Pharmacist, so what it basically says is pharmacist, if we do what Debbie just stated, under 1776.3, it would say, we'll start it at pharmacist in charge may refuse the installation or operation of a collection receptacle if in the exercise of his or her professional judgment, a collection receptacle cannot be operated in compliance with this article or in a safe manner for public health.
Okay.
So what do you believe about having a PIC be the determinant as to whether they can safely do this?
So would that be in addition to the pharmacy's voluntariness, I guess is my question? Because, so you're saying the whole decision whether to have a receptacle in the first place for a pharmacy could be voluntary, but then in addition to that, even if the, pharmacy would otherwise be willing to do it, if the particular PIC of that pharmacy is not comfortable with it for that PIC would have an additional veto essentially on whether they would participate in take back.
Yeah, if CVS
Okay.
decided to do it and say all of them are going to do it, do you believe the PIC should have the ability to say, well, in my pharmacy, because I don't have the space or because there's other issues?
Well, I don't really want to speak for CVS, but I think I want to speak as a kind of a retail pharmacist, and I think that there's certain pharmacies where it would be appropriate, and there's certain pharmacies that wouldn't be appropriate. And I think it would not be appropriate if you're in a high theft area. I think it might not be appropriate if you have a small pharmacy. And you might have a huge pharmacy, but where it's being placed, maybe you can't see it. So, I mean, I think there might be reasons why it would be
I'm
inappropriate.
totally in agreement with that. I was just trying to find a
Along
way
that
to
line,
say that.
I think, I mean, we put a lot of responsibilities on the PIC. I guess right now, unless I hear something else, I'm comfortable with the PIC being able to make that determination. I mean, we hold them responsible for the, the controlled drugs.
PIC's license.
Yeah.
If someone gets in there
Yeah.
because it was unlocked for some reason and takes something out.
So, yeah, I mean, I kind of want to get rid of that first part of the sentence, as you are aware.
Yes.
But, you know, starting with PIC, or the pharmacist in charge, I'm comfortable
That way
with
we're giving them a lot of responsibility, but they really should have a say in some
I
of
agree.
this.
Well, I think if you're making it voluntary for the pharmacy, then this is perhaps duplicative and unnecessary, unless you think there's going to be pharmacies that would elect to do that against the will of their PIC.
That's true.
So if you're making it voluntary for the pharmacy in the first place, then you probably don't need to have a separate provision. But if you're going to make it mandatory for the pharmacy, but allow for a PIC opt-out, then this may be.
So if we don't have this in here, let's say we just keep it voluntary for the pharmacy, and what happens in counties like San Luis Obispo where it's required?
Well, that's
And-
this preemption question that we don't know the exact answer to. But let's
They-
assume that you say it's voluntary and we really mean it to be voluntary, and, you know, any county that says otherwise is, you know, too bad for you. Then probably what would happen is someone would file a declaratory relief action against that county seeking to have their ordinance preempted or deemed preempted, ruled preempted by the state's regulation. And then that would be a subject of litigation. So that's what would happen with regard to the San Luis Obispo one, certainly, and probably with regard to the Santa Cruz one as well.
As it is right,
And just to add, the other thing I wanted to add in, and I think this is another concern that I've heard, and we did get, I don't know if all of you saw the letter that came from the National, NCDS.
NACDS, yeah.
Yes, and they were concerned about what happens when that collection receptacle is closed. So the other change I have in this is in hours under 1776.3B.
It's actually A.
Actually new A now. It says, in hours when the pharmacies close, the collection receptacle shall not be accessible to the public for deposit of drugs. The pharmacy shall lock the deposit slot on the collection receptacle and physically block patients from access to the collection receptacle by some means. That was just our way of trying to, and I worked with Ginny on this language, so that it doesn't, the collection bin doesn't get locked up and people start throwing trash around it. And then you come in the morning in a pharmacy and you've got all these bags of trash around your collection. So what do you think about that?
well, I think about Stan's drug again, and I don't know what I would have to do to physically block patients from access to the collection.
Well, in Stan Drugs, you'd be fine because you'd lock your pharmacy door. This is more for locations like in a grocery store where you just basically slide down your screen when you're closed,
Okay.
but your bin's outside in a public area.
So how do they block it? How do they block it? And
They couldn't safely have a bin then.
Or you lock it, or you lock the slot and throw a bag over it so that you can't see it anymore. Or just say, you know, you can't move it because it's got to be bolted to the floor.
right.
So you're looking at or you put a
Because
fence
you heard
around
bolted
it,
to
or
the floor, right?
Yeah. It's kind of standard.
Well,
So I'm just fine, and I'm open to other ways of doing this, but I'm just concerned, because we all know what happens when trash overflows.
oh, absolutely.
And you've got trash, and if you've got these in grocery stores and other locations where the public is going 24/7, I think you're just creating a public hazard to have these drugs laying
Oh,
around.
no, there's no doubt. So Josh, you were saying that if we don't include, as described in 1776.3 language, that it's voluntary?
Well, 1776.1A currently makes the entire program voluntary.
Right.
So 1776.3, the new language, is either duplicative or
Okay.
unnecessary, you know, one way or the other.
So if we take
So-
out the language that,
But if you wanted to just make the receptacle voluntary,
yeah,
then you
Yeah.
could put that in 70, I think that's what Amy was
That's what Amy's
aiming
trying-
towards.
That's what I'm recommending.
Yeah,
is-
and so she didn't do it yet, but presumably you would then go back
yeah.
and take out the voluntary language out of 1776.1 and say the overall program, we're agnostic about whether it's mandatory or voluntary, but with regard to the receptacles, those have to be voluntary, for instance.
Because I don't believe anyone can argue that our regulation on that receptacle and your ability to manage it is really a public protection risk. Because I really do believe there is. Because
Yes.
the drugs being on the outside, it not being managed appropriately, licensees that are on probation, You know, there's a lot of issues regarding managing that waste. You know, what if you're, I think Victor mentioned it, what if you're in a high area with burglaries and you're getting...
Any area is subject to burglary.
Yeah, we're actually number 3. I don't know if you saw it, that California is on number 3 in pharmacy burglaries in the country. Just came out. I mean, we have a lot of pharmacies, but still that's...
Come on, we can
high.
get to number 1.
Regrettably, that may be where we're going.
So I think, Ginny, you had something to say.
I was just going to say that we're spending a lot of time talking about whether or not this should be voluntary or not. I'm not really sure we need to focus so much on that. Why don't we just specify what the requirements are for drug take-back and just leave it there? And if you're going to do it, you comply with the requirements. And if you don't want to go through the requirements under the collection receptacle, then don't do that. Do the other one. But why are we bogging down on this voluntary versus not voluntary? It's getting in the way of important public policy about what we're trying to create here with respect to drug take-back. Just simply go, okay, if you're going to do a collection receptacle, here's what it's going to look like, here's what you're going to have to do. If you don't want to do that, then you can do mail back. If you don't want to do that, you've got 2 options there. The only third one, which nobody's talked about and it's not within the realm, you go to the law enforcement or somewhere else. Here's option 2. You can do both. You can maybe do neither unless you've got the county that wants you to do one or the other or both. And then you fight that out with the county, because I'm not sure that's our fight.
So what you're saying is that regulation would be silent on the question of voluntary versus mandatory.
Why are we talking about this?
So just don't say voluntary.
We're not mandating that they do that. We know how to mandate something.
Okay,
It
so let me
doesn't
just
read like this.
let me just make sure that you understand, or that the board understands, that even if you say don't say voluntary or mandatory, there are other possible points of conflict between, or there could be points of conflict between your regulation and a local ordinance that may lead to questions of preemption, regardless of whether you say voluntary or not. Just for instance, you know, the requirement that you be DEA registered, not employ felons. If a county doesn't have that as a precondition to its mandatory requirement, it requires everyone to be participating, even if they don't have a DEA registration. That could be a point of conflict. Things like that. So, just as an example, I'm just saying that I just want you to know that it's not going to be. I don't think it'll be possible for you to entirely absent yourself from the possibility of, you know, someone claiming that a county ordinance, particularly a mandatory one that they don't like, is preempted. But I do, that's actually a way of me echoing your point, which is that I don't think that the board should focus so exclusively on the question of whether it's voluntary or not. My, you know, this is more of a policy decision than a legal decision, but my personal point of view is that because it's not going to entirely remove this question, you might be better off avoiding saying that it's voluntary, because you're not going to, you know, that's not, it's not going to help really one way or the other. So.
But if we say in here, though, that a pharmacist in charge is responsible for ensuring and keep the voluntary out, will that have the same...
So your pharmacist in charge is responsible for what?
For making sure that they can do it as in a safe manner and per all the regulations in the, to meet all these regulations?
I mean, there's no way. So, I mean, just as an example, let's say you're silent on the question of whether it's voluntary. And so you just say, if you're going to do a drug take back, here's how you do it. And we are authorizing pharmacies to do it, which up to now, as you know, there's been no explicit authority for pharmacies to take back drugs. So we allow this to happen, and we say this is how you should do it if you're going to do it. And then in some county or municipality that is mandated by a particular city or county, and a particular pharmacy in that circumstance doesn't want to do it because of space considerations or any of these, or it's in a high crime area, or there's some reason that they have a legitimate reason for not wanting to do it. Our regulation, the board's regulation, may or may not help them in their attempt to be exempted or to litigate with the county or the city to be to receive a waiver from the mandatory requirement. So I don't think it's going to be, there's no clear answer one way or the other. So it might, if we say in our regulation the PIC has to be comfortable with it, essentially, that might help them in some argument saying, you know, in this county, whether or not you make it mandatory across the board, I'm going to litigate the issue of my particular participation. So it's really going to be an evidentiary question.
Can I ask Josh one question? Or another question?
Dan?
So getting back to where a county might say to a pharmacy, you know, pharmacist, you're going to have to counsel your patients on the disposal of pharmaceuticals that aren't used. So we set regulations that require pharmacists to counsel specific things to a patient. Can another entity besides the legislature come in and say to a pharmacist, you have got to counsel these specific issues aside from what the pharmacy board tells you to, or in spite of what the pharmacy board tells you to do? I mean, are there now two regulatory bodies dictating or regulating what a pharmacist is going to have to do in the course of a day?
Yes. There are complicated answers to that question. So if they, for instance, wanted to add to and not replace, and it did not conflict with what the Board of Pharmacy, assuming we're talking about, let's assume we're talking about a state statute as opposed to regulation. Let's put that question aside for the moment. Just assume that we're talking about the possible conflict between a state statute and a local ordinance.
Right.
And that's the exact issue that we had with the dental board, the dental fact sheet. So in that case, there was a state law saying that dentists, with each first time they saw a patient, they had to hand out this particular fact sheet. City of Berkeley, where I happen to live, tried to make it so they had to give it with each visit, not just one time per patient. That was, an Attorney General opinion issued. It wasn't a court decision, but saying that would be disallowed because it was specifically conflicting with the statute's requirement that you only have to do it once per patient. So here, if the board requires that you consult on certain topics each time there's a new drug or a change in drug, or all the requirements for the consultation requirements, as long as what a municipality was adding to that wouldn't interfere with that, I don't think that would be preemptive. But that's again one of those things that no one really knows until it's actually tried in litigation. But I believe they would be allowed to add to it, but they would not be allowed to say, forget what the Board of Pharmacy says. You don't have to talk about the drug at all. Instead, what you have to talk about is, how you're going to get rid of the drug when you're done, or whatever. So that's a long answer to it.
And it is a complicated issue.
Yeah. So I don't think I think it's the nature of multiple layers of regulation. I mean, we have this issue we're not used to looking at it with county or local entities. We're very used to looking at it with regard to our relationship with the federal government in terms of how the board's jurisdiction overlaps with the FDA or the DEA, and all of those kinds of interrelationships have been worked out over the years, more or less. So we know basically that even though the Board of Pharmacy regulates pharmacies and is the primary entity, there are ways, particularly with regard to compounding, that the FDA also has authority to regulate pharmacies, and and those two things could be entirely overlapping or not all the way overlapping. The same thing is going to be true here. The Board of Pharmacy has the power to regulate those entities as pharmacies. The local entities have the power to regulate those entities as local businesses within their communities. And, as public safety issues or public waste issues or whatever the issue might be, they have some ability to say something about that entity as well.
Amy?
Yes.
Some pharmacy might want to have those bin in their pharmacy. Like I'm sure a lot of chain would like to, because it does attract patient to the area and increase business. Some people would not like it because there's limited space or whatever. But I only would support that if it's voluntary. But if we don't say voluntary, then the city will make it mandatory, and then they will make decision for us. But I don't think I would like that. So we have to make it clear that it's voluntary program. I only support it that way.
Thanks, Albert. Ramon?
I want to stay oriented as to where we are. I think where you had us was on page 3. talking about what we do with these receptacles when the pharmacy's closed and the store is still open. Am I correct? Is that where we really were when we started getting back into the bigger issue?
Yeah, and
Okay.
actually, that was my last recommendation.
Right, because I would, like to finish with that and then just notice that, when we are all done with that, I do want to come back to the issue of are we preempting San Luis Obispo County or not? And that's where I will leave it when we get to the end. Thank you. On this thing, the receptacle, so I guess we're thinking about like a Rite Aid, and there's the pharmacy counter, and there's the receptacle, but then the pharmacy pulls down the screen, and so the pharmacy's closed, but the store is still open, and people are still going in and getting their socks and candy and everything. That receptacle sitting out there now without anybody looking at it, and what you're suggesting is we got to do something to make sure that somehow.
Especially if they lock let's say, it's like, think of a mailbox. If you
Yeah, no, I
lock
got
the
the
mailbox,
right.
they're just going to put in the morning they'll pick it up, and they'll lay their trash right next to it. And
Oh,
that
you're
could
worried
create a
about,
hazard.
yeah, other people just, no, do we have any evidence that that happens? Just,
Yeah.
okay. All right, so you're trying to
It's
fix
a
it.
concern, actually, the NACDS brought up as well.
Okay, and it turns out, I gather that there's no way you could just have that receptacle behind the counter. I guess somebody was saying there's no room or something like that, or.
DEA requirements are that it be away from the controlled area of the pharmacy, but within the
Oh.
mind's eye view of the pharmacy, so that there's some oversight.
So, but is the DEA specifically saying you can't have it behind the counter?
Right, they want the consumer to put it in, and the pharmacy will not allow consumers.
Okay, so it's got to be
They
out
want to be
there.
very clear that there's no
Right.
other hands touching it before
All
it
right,
goes
no, I
in the
got it,
receptacle.
I got it. So,
So if you're in a grocery store and you
Okay.
really,
yeah.
you have to have it physically. No, but if you're in a grocery store and you have it physically, you have it up and the store's open 24/7. You
Right.
could put one of those slider doors, with the, and close off the waiting area. Because most of them, I think, like an accordion, most of them will have them in a waiting area anyway, is where I expect they'll probably be.
You're thinking that along with box, then there'd be like another installation, which would be like a curtain or something.
Yeah,
that-
like an accordion door just to block off the waiting area.
Can I make a suggestion?
Yeah.
For them, just sequester it off somehow, but will people still pop the drugs? Maybe, but maybe you try something else in it.
Or they could do it anyway now.
Make your
Right.
suggestion.
That's a good idea. Okay, no, it's a bad idea. So, all right, so you're just trying to come up with a resolution.
I'm just coming
for
up
that
with a way
issue.
just from
All
if
right.
we're going to do this and they are going to have a bin, whether it's voluntary or not, they actually were protecting the public.
And so, by the way, are people already dropping off bags of unused drugs in drugstores?
I'm not aware of any at ours.
All right.
There are voluntary pharmacies of California. Heidi's actually got collecting in from some of them. They collect drugs right now, and we're kind of.
Well, patient been dropping off in my pharmacy now. I mean,
there you go.
even I don't have a bin, They say, well, I have a, I don't have a medicine, I want to get rid of it, what I gonna do with it? So what I gotta do, I have to, help him to take it, and then I go drop off the bin myself.
At the law enforcement?
Well, the bin is only around the block from me, so it's close enough.
Don't tell the DEA.
Okay, so what are,
Don't tell the DEA. Don't tell the DEA you're taking those drugs back.
And tell everybody watching us on TV to ignore that comment.
That was Victor that said that, right?
Let's move forward on.
Amy.
Can I make a suggestion?
How do we feel about this voluntary language? Because we can do what Jenny has recommended, which is basically stay silent on the whole thing. We can include the voluntary. What is the board's wish?
Well, what I would like to do, and this is just to get a vote or even reject it altogether, I can make a motion and then just have it, nobody second it, and then that's what happened. Or I can make a motion and it got seconded, and we'll have a vote. And
What's
so,
your motion, Ramon?
Ramon, you
motion
really
would-
know how to sell your motions.
Right. Well, I don't know what's going to happen. So Josh has suggested earlier that we make a statement that this is not intended to preempt, in particular, the kind of ordinance San Luis Obispo County has. And I understand that that needs to be wordsmithed because there's a whole lot of things we do want to preempt, but this is not one of them. Or this is what I'm suggesting, right?
Right.
That this particular ordinance we do not want to preempt. So I want to make a motion.
So,
that
Ramon, are you saying the motion that's similar to what we just saw here, where it says provision of such service, this is voluntary unless required by local, state, or federal law?
Yeah.
Is that what you're asking?
I'll put that out there.
I think that's probably better than what I said.
Okay,
earlier.
I will put that out there as a motion that we pick up this phrase unless required by local, state, or federal law. And that's a motion, and let's see what happens.
Okay, is there a second?
Wait, just for clarity, you're adding that to the blue?
Yes.
Yes.
Which one is the blue one? Is that the new one or the old
The
one?
blue one's the blue one's the noticed language. It's the current.
Minor,
Oh, I'm sorry, not noticed, but the language that was in the packet.
Are you okay with the language regarding
Yeah,
the
I'm fine. I don't want
closing
to
off the
waste any more
bin and all
time.
of that?
Yeah, that's all good. That's all good. I'm just, this one thing here, unless required by local, state, or federal law, that there was 1, 2, 3, 4, 5, 6, 7, 8 words. Is that 9? No, it's 8 words. I move that we insert those 8 words right after volunteering.
In 1776.1A.
Thank you.
Is there a second to Ramon's motion? Okay, motion dies.
Can I make a motion?
Yes.
I'd like to make a motion that we move forward with the language that was
In the packet.
the packet.
The blue version.
Yeah, the
fine.
blue version.
Is that the
packet.
original?
Yes. Not Amy's new language, just the language.
Is it
has-
okay for you if we add the issues about when the bin's closed and all of that in there?
The language that Ginny was going to add, the liner stuff?
No, the language about if the bin's closed, it has to be, basically not be open to the public.
Oh, I see.
and- Let me see it.
Amy, I think you have a redundancy
I think
in there.
that's fine.
Okay, so basically, your motion is that it's voluntary mail order bin, and it takes out the PIC issue, it just says it's voluntary.
So
Right.
just to clarify, Debbie, I'm talking about on the bottom of page 3 of 10, where it says, in hours when the pharmacy's closed, the collection receptacle shall not be accessible to the public for deposit of drugs.
Correct. I'd be okay with that modification.
Which one is
I'll
it
second
again?
that.
Bottom of 3 of 10 and the hours here.
By some means, where it ends up by some means. So,
Okay.
in hours when the pharmacy's closed, the collection receptacle shall not be accessible to the public for deposit of drugs. The pharmacy shall lock the deposit slot on the collection receptacle and physically block patients from access to the collection receptacle by some
Okay,
means.
so that stays in, but the PIC comes out.
Yeah.
I can second that if you need
I
it.
said-
Did you second it?
I did.
Okay.
Okay, so we have a motion, a second, to go with the original language, keep the voluntary in, and add this language about the physical restriction of the box.
Yes.
Okay. Public, comments? I think we're gonna go to public comments
Can
unless the
add that
board,
other one too,
board
but
has
it's
any
not
comments?
Yeah, I have a comment. I'll be voting against this because I think the board has now made it clear by not even acting on the motion I just made that we are going the direction of preempting San Luis Obispo County. And I want it made clear to the counties, the cities, the legislature, and the courts, that's the direction we just took.
So can I just, part of the reason I want voluntary is that, and I think, Josh kind of validated that there are going to be situations where it's not right in a particular pharmacy. So whether it be at the store level, at the city level, at the county level, that, I think it needs to, that there's too many variables. So I'm not trying to butt heads with the County of San Luis Obispo. I understand they kind of got ahead of us on this issue. My mother always said two wrongs don't make a right. I just really think that the Board of Pharmacy needs to stay in control of what happens in the pharmacy.
I think Albert had a comment.
Yeah, the bin, I mean, once you put the bin in certain location, it's very hard to move back and forth, or lock it and close it. But can the bin, it's just like mailbox. I mean, you could actually, at the end of the day, you could put a padlock on it, then nothing in and out. You don't have to relocate it each time. So, I mean, you don't have to move it all the time. So I only support it if it's voluntary, but the mandatory I will not.
Okay, public comment.
May I make a quick suggestion that has nothing to do with this issue? And that is that before you notice it, I would recommend that you actually remove, there's a couple references to a form in the draft regs, and since those forms don't exist, rather than put that in the notice language, and I can.
So where are they, Laura?
Those are DEA forms. Those are.
It says on a form designated by
number-
the board.
Which number are you
Page
looking at?
2, sub H, so it'd be 1776.1.
Which number?
Sub H
Sub H.
and I.
Shall notify the board on a form designated by the board.
Okay.
H.
Yeah, we don't have such a form yet. So do we have to
But
remove
OAL
it
will
now?
require it as part of the reg, so my,
Tell us what we're gonna ask without it being there.
that's my
We'll do
recommendation.
that at a 15-day, I think we're gonna get a lot of comments.
Okay.
Kind of tell the general area where we're, yeah, our regs, we have too many regs already.
One more thing.
Yeah,
Th-
Albert.
To me, I think this is a pharmacy board, and we license the pharmacy. I think we should take control of it instead let other people control it. I mean, it should be under our jurisdiction.
Thank you, Albert. Okay, public comment. Good afternoon.
A little green light.
There we
goes
go.
on.
Good afternoon. I am Doug Kobold. I am a program manager at the County of Sacramento Department of Waste Management and Recycling. I am also the vice chair of the California Product Stewardship Council, the president of the National Stewardship Action Council. Just had a couple comments. Today I'm representing Sacramento County on these comments. I know there's been a lot of discussion about preemption. Obviously, you can kind of feel where I'm coming from as a local government representative, that preemption is never good for us. We do like to have some control. I understand the board needs to have maintain some control over your regulatory entities, but when it comes to local ordinances, things that happen here can have effects elsewhere because it sets precedent, and precedent was brought up here earlier. So should this board decide to preempt and make it so that the counties cannot, if they choose to, make a mandatory requirement, that can trickle beyond this drug take-back program. For example, City of Galt was brought up. City of Galt is in my jurisdiction. They recently passed an ordinance for a mandatory take-back by the retail pharmacies. There's only 4 in the City of Galt, a little small city.
City of what? I'm sorry?
City of Galt.
Galt. Okay, thank you.
And the 4 are all major chain pharmacies. When the City of Galt was looking at passing that ordinance, when they're developing that ordinance, they were talking with the stakeholders. The youth commission who pushed that ordinance and got the city council to adopt it, the youth commission went to all 4 of those pharmacies, and all 4 of them had the same answer: we won't do anything unless you make us do it.
Unless you
Make us do it. So Galt went and made them do it. I'm not saying that's necessary everywhere. I don't think the pharmacies really had that intent to carry that message, but certainly that's the kind of message that can come across. So here you got a case where if you make all these programs voluntary only, you may preempt that ordinance as well. Not intending to, but it can have that effect because of the precedent-setting nature of it. I want to thank your counsel for his clarification from his comments from the last meeting. I was president of the last meeting. If this board were to state your intent is not to preempt local ordinances, that would be very helpful for us, because then when we're challenged, if Sacramento County decides to go forward with an ordinance and for some reason we decide we have to make it a mandatory ordinance, mandatory take back by the retailers, that's not our intent, but if we have to go that way, and someone challenges us, one of the pharmacies challenges us, we have the ability to say, okay, you say the board says it's voluntary. The board is on record stating this was not to preempt your ability to pass the ordinance and make it a mandatory take-back.
Can I ask you a question?
Yes, sir.
So do you have exemptions available for pharmacies where it just isn't applicable for a particular place?
I was going there.
Good.
I was going there, actually coming off of the president's suggestion. So another thing I did like, this discussion, as long as it's been, I apologize for the lateness of the hour, I will make it brief. I've learned a lot today too, watching you all interact together here and talk about these situations, all these issues, because they're all important to us. But President, your suggestion was very good on the PIC, to have it be a case-by-case basis. This board, that's kind of like almost like a settlement of a preemption, is that don't take away our ability to pass an overall ordinance that may require a mandatory take-back, but set up an issue where you can preempt areas or facilities that can't host the bin for whatever reason because it's not safe. Because that's our goal too, public safety, protection of the public health. And so I think that's a very good compromise. And it still gives the board the authority to protect your pharmacies from not having to follow an ordinance that may just put them in really bad, dire straits. The case of the down in Carson. Was Carson? Absolutely. So finally, one other thing that, and I don't have a lot to talk about this, is the counties are in charge of enforcing the Medical Waste Management Act. There will be some overlap between what you're taking on here today and what will happen with that enforcement arm. So, and until we see the final regulations, and I can compare that to the Medical Waste Management Act and see where there's overlap, I can't speak too much to it, but I just wanted to remind this board that there will likely be some overlap there between those two. Thank you.
Thank you. And your public comment? Good afternoon.
Afternoon. So I appreciate this topic is very complex, but I just wanted to touch on a couple of points. My name is Megan Harwood, representing Orange County Prescription Drug Abuse Prevention Coalition today. One of the things we were concerned about in the regulations is page 387, the reverse distributors and incineration sites. I don't know if there's any more development on that, but we had only one that has been like a major reverse distributor, which was Surf in Long Beach. So we're concerned if we're making all these mandatory programs, the envelopes at least sound like a separate issue where at least it could be degraded into the envelope and be safely destroyed in the landfill. From my understanding, there would be charcoal in there that would absorb it and not make it an environmental hazard. But if we are making all of these mandatory issues in counties and allowing that to go forward, where is the destruction going to be taking place? Because this one, I think it's called Southeast Resources Recovery Facility, seems to be the only one we could identify. And I'm just worried there'll be a backlog of all these medications and it'll pile up and we'll have a bigger problem later in the future if we don't address that.
My understanding of the regulations, ours are based on the DEA regulations that were issued in September 2014. So that's where all this is based on. So I think these are actually set out by the DEA, and they all have to actually sign up as DEA reverse.
They have to register with the DEA. They have to, one, be a reverse distributor. Waste haulers are not qualified. They have to be reverse distributors. And two, they have to have an incineration location if they're going to accept the mail back. Or actually the actual bins, other than a reverse distributor can take them, but then they have to take them to a reverse distributor.
Aren't a lot of them out of state? So there's actually a lot of shipping that's
I know Texas has got one, an incineration location.
Okay, that's what I was going to ask. The reverse distributor essentially means an incineration site as well. They have to be connected.
No, a reverse distributor, we've got a couple of them in the state. They do not have the ability to incinerate in California. They have to ship out of state too.
Oh, it's required.
Our Air Resources Board does not allow incineration.
Oh, I see. Okay. All right. So that's, yeah, we were just concerned that that might cause an issue going forward. Yeah.
That's a statute.
So
a statute preemption?
No, my guess is there's probably a statute or two.
And then regarding, I don't know do we have any say over the, all the lawsuits going on with the pharmaceutical companies paying versus the pharmacies paying? Because I see that as a big deterrent for pharmacies wanting to sign up for these receptacles, aside from the liability it comes along with. We actually were told in 2010 at the coalition by drug companies directly that they would raise the price of medications if they were being asked to foot the bill. So in theory, that sounds like a great thing that the pharmaceutical companies would be footing the bill on these destructions. But in reality, we've actually just been directly told by them that they would incorporate that into the cost of the drug. And we're wondering, is there any way in like statute form or legislation to prevent that from happening? To mandate the drug companies can't do such a thing?
What's happening right now is it's being taken at the local level, so all the counties are doing different things. Some of them are mandating the pharmacies to pay for it. Others are actually going after producer responsibility. I think Heidi actually outlined it before. So I think unless the state actually does something on a statewide level, I think that's where we're at for now. And I'm not sure where we are in terms of having the state take over.
Yeah, I didn't see that in here at all, right? It's not addressed in the current statute the way it is.
And that wouldn't be something we would be involved in. We're really here to make sure we protect the public and make sure that the regulations in place for pharmacies are there.
Right, yeah, we're just, because I think they were saying that they could kind of, you know, hurt the patients that really do need the pain medication in order to protect those who are abusing them, and that would be a real shame for the protection of the public if they're not able to get the medication that they really need because the drug prices are rising, if the pharmaceutical companies are required to pay for that. I'm not sure the jurisdiction, if that's even something you can address in the committee.
Rising prices of drugs. I know I just saw an article, Pfizer basically took like a 10% hike on a lot of their drugs just in January 2016. So I think they raise prices at any time for any reason. So I'm not sure there's anything we can do on the inflation of drugs.
Yeah, it would be hard to regulate that because I heard they can just say it's for a different reason that they're raising it. So that was just something we were concerned about and curious if there was any legislative way.
10% across. Some of them, the drugs went up to 20%.
Wow.
Things like nitrostat, I mean, really significant meds.
Nitrostat?
Took a huge hike.
But it's not possible to have to regulate where the money for the disposal is coming from, like the DEA money that they collect when they are doing like illegal seizures of medications, or what was the other? I lost my place. We had two ideas.
The money part's something we're going to get involved in here.
Yeah, I know. I know you said that. I guess it's just because part of the patient safety concern is that if there was a lot of talk at the medical. What was it? The medical prescribing in April 2015 meeting. Oh, I know why I can't find it. I'm in the wrong file. Yeah, the medical committee meeting, there was like a patient advocate group that came in April 2015 and spoke about how they were actually seeing a lot of doctors refusing medication to like children with oncology issues who were terminal and issues like that we kept hearing about. So we were just curious if there was something that could be done to build that into a regulation to protect those types of patients who are, you know, terminal patients who are actually getting pushed
right
back
now
to doctors.
that's an item that's not on our agenda in terms of some of the prescribing. So if that's something that you believe we should probably look at in the future, we can certainly consider that. But because of the regulations we're under, we need to follow the agenda items.
Okay, how do we suggest that? What's the process to suggest something like that? In the comment period or in a different way?
Well, there was a public comment period we had at the beginning of the meeting, but because you said it, we can probably, we'll take that into consideration.
Oh, okay, wonderful. Okay, thank you so much for your time.
Thanks for your comments.
Oh, thank you.
Amy, I have a comment.
Yes.
I understand that the county, the city, they're trying to do a good job protecting the public safety, but you're getting the wrong person. When you're coming after the pharmacy to do that, you're getting the wrong place. When you pay for high prescription drugs, the deep pockets are not the retail pharmacy. It's the manufacturers and the insurance. Because you guys didn't know how tough it is right now for us to run a pharmacy. Like Albert said, you make more money selling a cup of coffee than filling a prescription. We might look good to you, but you don't know how tough it is for us to survive because the insurance company dictate all the money who pay for us. We have no say to any money that we make. So it's good concern that you want to be public safety, but don't go after the little drugstore and say you have to mandate to do this, to do that. You're getting the wrong person, okay? I mean, this thing should be voluntary, and if they are willing to do that. The reason why the county come in to do stuff like that, because we have never had a policy in place for all the retail pharmacy. That's why you have Santa Cruz, Alameda, they start doing stuff like that. But I believe that if we go forward and have all this rec in place, most of the counties, they might not even come up with this kind of drug take-back program once we have that in place. Believe me, because they know that all the policy and procedures in place for the retail pharmacy, and there are many other places for them to do the drug take-back, just like take to the sheriff station, the police station, like the DEA, they had it done before. But going after have them come to the pharmacy is not the right place.
I think Jenny had a comment.
I just want to state that there is currently in the legislature a bill, or there'll be a new proposal, because I think we're coming up to the deadline on the current House of Origin for 2-year bills. But there is a proposal being circulated that I understand that one of the things they're looking at is garbage collection services to provide mailback order or mailback envelopes to households that want those, so that they can not put them in the landfill, and that they can request it when they want it, and it'll come from the city or the county, not from a pharmacy. So that there are other folks stepping up to kind of help fill some of this void that's out there, that in this case, a mailback envelope is something that almost anybody can provide. The DEA wants them registered, but once you have them, you can send them and share them, and that would help reduce the cost to any one segment.
Well, to me, the public safety, the public should be paid for. It should not be the burden of the retail pharmacy or the pharmacy pay for it.
Any other public comment?
I'll keep it quick. Heidi Sanborn with the Product Stewardship Council. This is really a healthcare industry issue. And it's really unique because I've never seen it in any other country. I think I've said this before, where the healthcare industry products are being burdened on law enforcement and everybody outside of the healthcare industry. The industry has not stepped up and dealt with these issues. Other industries like oil and tires, you're returning your oil and your tires to where you return your car. You return the beverage containers back to the grocery store where you bought them. People intuitively think to go back to pharmacies to return their medicines and their needles. That's just what they do, and that's why every other country in the world is doing it. If this does go forward and the burden is on you preempt local governments from doing what they feel is important to protect public health, I just don't think this is going to go well, because we don't have a solution right now. And it does all come down to money. Who is going to pay? And I think you've said it very clearly. You don't have the money, and the pharmacies are not where the big bucks are. And we just heard comments about the cost. Well, in the Alameda court case, there were stipulated facts that 1 cent for every $10 spent would be the cost of the program to the pharmaceutical industry. In Alameda County, they sold $1 billion worth of drugs. The program cost would be $1 million. In one legislator's words, that's budget dust. It's not an expensive program to that industry. You wouldn't even notice the cost in the drugs. Mexico and Canada, where our seniors go to get their affordable drugs, has these programs. It doesn't make any logical sense that it's going to raise drug prices because we do this in the United States. So,
can you clarify? Are you talking about the pharmaceutical companies or the drug chains?
The pharmaceutical companies themselves,
so
not the drug chains.
Not what they're talking about.
So yeah, we're not saying that the retailers pay. Right. That's not how producer responsibility works, and that's our area of expertise. So, anyway, I just wanted to get that out there. It seemed like some of the facts were getting confused, and I'm not surprised. We did hear in San Francisco that some of the drug companies had said it would cost $5 a prescription for the program, and I can assure you, if they charge that, that's not the cost of the program. At least the program we're familiar with anyway. In British Columbia, it's less than $1,000 per year per pharmacy.
But that's one distinction, though, because when you go to buy a set of tires, the company can charge whatever they want to you. But when you come to buy a prescription from pharmacy, we cannot charge whatever we want to you.
Right.
That's a big difference. Okay, they charge you to pay more for the set of tires, so even if you return the tires to them, they might bear the burden because they already charge you for it. But pharmacists, we don't charge you, we don't have the ability to charge you whatever we want. That's one thing you have to make it clear. Because
well, I think it would be nice if everyone could sit down at the table, which we've been trying to do for 5 years at the state level, to try and hammer out a statewide solution.
Yes, I understand.
Unfortunately, it ends up degenerating into city and county by fights and ends up like this. But we could have all saved ourselves a lot of time and money if everybody had sat down together early on and tried to figure out a statewide solution that worked for all the parties. And I hope that still someday that could happen.
And just to clarify, I don't think this board is in any way saying that drug take-back should not occur. I think the position that I've heard from all the board members, at least most of them, is that this should be a voluntary process, and we shouldn't be mandating it to pharmacies. That's the only thing that I've heard.
All the EPR programs are that, except for the one that just passed in Santa Cruz.
I think we're in agreement.
Amy, the one in Alameda County is, I think, that the manufacturer provide the funding for that, okay? But where the manufacturer could passed on to the consumer, because like you say, they increase the drug price, and it's the consumer end up paying for it eventually, so somebody have to pay for it, so.
And they pay for all the commercials, and they pay for lobbying, and they pay for a whole bunch of stuff.
Okay, any other public comment? Thank you. Good afternoon.
Afternoon.
Are you setting up an office there?
Yes.
He looks like he's going to stay a while.
How long is this going to be?
When does your plane leave? Thomas Hare, staff member for the City of Santa Rosa. I help to run a local safe medicine disposal program in Sonoma County. We are currently pursuing a voluntary ordinance, and we hope that that will work well. If it doesn't, however, I would be concerned about losing other options at the local level, as has been discussed. Additionally, one further point to add into that discussion, and this actually is a point that Bill Worrell made, that if you have an ordinance that says if a pharmacy is not participating in a drop-off program, then the pharmacy must have a sign listing pharmacies that are participating. You could actually make an argument that you've then mandated the pharmacy to assist patients seeking to destroy. Thus, you have violated the voluntary provision of the state law. And that would be very concerning to me. And so I would ask you to think about that in addition to the other factors that you've thought about. I also, Doug spoke to a compromise that I thought was a really interesting idea. I heard a lot of concern, which makes a lot of sense to me, about requiring pharmacies to have bins where it does not make sense for that pharmacy to have a bin. It would not be safe for a number of reasons. And I think that there are ways that you could make sure that that happens without preempting local action on these matters. One of the things that I do in my job is I run a dental amalgam separator program. And we had exemptions, we had waivers, there was a process for a dentist that would not have to install that. And so I liked his idea very much for how you guys could act in that kind of way to protect the pharmacies. I also was wondering about the issue of physically blocking, that's the first time that I've heard that is here today. I was looking through, this is why I brought this one, and I know Ginny is very familiar with this. This is the DEA regulation, which is quite long and very interesting.
Happen to have one right nearby.
Yes. I don't believe there's anything in here that requires the locking of the top. Is that correct, Ginny?
There's nothing to lock the top?
There's nothing requiring. I know that the top has to be lockable.
Right.
But is it true that you guys added the provision that the pharmacy would have to lock the top at the end of their business day or what have you?
You have to lock the slot according to the according to the DEA. I think that is a requirement.
Is that in
Pharmacies
here?
When the
closed?
pharmacy's closed, because again, they don't want hands going in there, even though you supposedly are going to have a bin that doesn't allow a hand to go in. I think there's, if you have these things sitting in an unintended area when there's no one around, people want drugs enough that they may well enter. And I think the DEA has to lock. I can look and see if I can find, we'll talk offline and do that.
Okay,
Let's not
that
take
sounds
the board's time
fair.
here.
That's fair. Another issue maybe that we can talk offline is on page 4, 1776.3H. I just want to ask for some clarification in that, and I can ask you about that later, about making sure that when you're talking about tight-fitting covers and rigid containers, that you're not going to end up precluding some of the solutions that I think you guys would be happy with.
Want the board to comment on that at all?
I don't know if they would want to or not.
Okay.
Do you think they should?
I don't know. I'm listening to
Do you
what the
have
board
any
wants.
recommendation? Do you have any concerns with this language?
When I hear tight-fitting cover and I look at a cardboard box, I'm not sure that that counts, personally. I would hope that that it could, but when I see that language, it makes me uncertain.
And when we included it, I think we were thinking of the box, of a cardboard box. Provided the liner itself is impermeable so that it doesn't leak, because again, what we're trying to do is to contain what's been deposited and transport it in a manner that doesn't jeopardize the safety of anybody that comes in contact with that liner.
And I also just am hoping that the language, I haven't had time to study the US DOT standard, I'm just sincerely hoping that that's not going to end up requiring either a metal or a plastic container, because that would be very onerous. On page 7, 1776.5b specifies incineration. And I feel that that's going above and beyond the DEA regulation, which specifies non-retrievability. And so I was just hoping that we could maybe, we can quibble about that in the comments and such. And I just want to state how important this issue is to so many people in such a timely fashion. So I really appreciate you guys are working on this, and anything you can do to move it as quickly as possible would be very much appreciated. Thank you.
Thank you. Any other public comment? Good afternoon.
Almost good evening. My name is Eileen Liang. I'm.
Speak into the microphone.
Oh,
thank you.
Eileen Young?
Eileen Liang. I
Liang.
am with the City and County of San Francisco. I'm speaking on their behalf today. There are two things that I wanted to mention, and the most important thing to us, to San Francisco at the moment, is the passing of these regulations as soon as possible. You guys know that San Francisco has passed a local ordinance to provide residents with a permanent and sustainable program for the take-back of medicine. We are expecting pharmacies to step up to the plate and participate, and I know a lot of them are looking to you guys to provide guidance on through these regulations on whether or not, and before they decide whether or not they should or can participate in the new program. Sorry, I had a whole script, but then this whole meeting has got me so...
Eileen, do you have pharmacies right now participating? Because I know I heard
yeah, I was
Dr.
actually with
Casablanca.
Mr. Castelblanc when he came to visit one of our pharmacies. We have 12 participating pharmacies. All of them are independents. We also have one community center. As well as our police stations that take back controlled substances. And so we really just urge the forward process of these regulations, and we urge that you guys, quickly pass these regulations, even if they're imperfect, onto public record, or public comment, excuse me. And then the second issue that I wanted to comment on is the preemption issue. Our ordinance is voluntary, and we definitely want to keep it that way. We don't want to, burden pharmacies in a way that they don't want to be. However, if for any reason that we're not getting the needed participation from pharmacies to create a convenient program for our residents, we would like to have that option to in some way require something that pharmacies will provide some kind of service for this much wanted and much needed service for the community.
What kind of participation are you enjoying right now?
So right now, our ordinance requires five take-back locations per supervisorial district.
And how many districts do you have?
We have 11.
So 55 pharmacies
55, yes.
throughout San Francisco?
Yes.
How about the chain store? Do you get any participation from the chain?
I don't know. So our ordinance is funded by pharmaceutical manufacturers, so they're handling the implementation and the funding part of that. Currently, our pilot program has no chain pharmacies. All of them are independent pharmacies at the moment.
And do you know how it's funded?
Right now?
Yeah, I know, but I mean, do they pay for the mailers, or they give them a stipend for the container? I mean, how do they fund it?
The manufacturers for our ordinance?
Yeah.
Well, our ordinance is not has not been implemented yet. It has been passed, so
I thought Ramon visited a place. No.
So that is our existing pilot program.
It was self-funded, wasn't it? Because we had a presentation before where the county was actually funding it for a while.
Yes. Right now,
Pilot,
it's funded by the City and County of San Francisco. Yes.
Yeah, that's the one I went to. That's where I saw the little, I have pictures I wanted to show you, but I was told I can't, because it's just one little box, right as you go in the front door, and that's it.
So let me ask you, if you say right now you've got enough voluntary participation, do you really believe that if you went to a pharmacy and say, we really would like to utilize the pharmacies in this neighborhood, what would it take for you to come on board? You don't think that kind of negotiation in terms of working with them to say, will it be to reimburse your costs? What will it take for you to come on board? You don't think that would work, rather than just telling them you have to do it?
Well, right now our ordinance is voluntary. So we don't anticipate any of that going on. And again, this is a pharmaceutical funded, manufacturer funded program.
Funding's not an issue then?
Funding's not an issue, and they're actually implementing it. So we are not implementing any of this.
So that's
we're
their
just serving as an
requirement.
oversight.
It's their requirement to come up with the 11 or 5 per supervisorial district?
Yes.
Okay.
Yes, that is all them.
So that's probably what the pharmaceutical manufacturers will have to do, is go to each pharmacies and say, what is it going to take for you to come on board?
Yeah, yeah, and again, we realize that each pharmacy is different, and that's why we have the voluntary part of it, and you know, all of our existing participating pharmacies are independents, and we actually have, you know, a few pharmacies that really want to participate, but we have no funding for the existing pilot program. So, you know, we don't anticipate the voluntary issue to be a problem, but if it is in the future for some reason, you know, we do want to have that option to you know, have something be mandatory in order to create a convenient program for residents.
Thank you.
Thank you so much.
Oh. Public comment. Good afternoon. Oh, got the trio coming up. Good afternoon.
Hi. Good afternoon. Angie Minetti with on behalf of the California Retailers Association. Wanted to support the motion that's on the table before you today. I appreciate the dialogue that has taken place here, and I think, you know, definitely appreciate the board weighing the public safety considerations, and, you know, furthermore also weighing the burden that some of these programs as proposed have on pharmacy operations as well. I want to be brief here, and you all are very, very much familiar with the board's vision statement, Healthy Californians Through Quality Pharmacist Care. You know, I believe that our pharmacy members do share that vision as well. And, you know, providing quality care and serving our communities in that fashion is our top priority. We do acknowledge that sensible disposal options should be provided, and, you know, we've been working with San Francisco and definitely appreciate San Francisco's comments here today. And, you know, it's been a very good experience with those counties that have moved in the direction to make the pharmacy participation voluntary, where we're able to have a collaborative discussion and be a part of a process as these stewardship plans are crafted and developed, as the maps of the regions that are considering this are, you know, are evaluated from the different pharmacies, the different locations, who can serve, what are the staffing capacities there, what are the propensities of burglaries for some of those pharmacies. So it's been very nice to be a part of that process. And I will say, you know, maybe there was a time a year ago when the board could have been silent on the preemption component of the regulations, but unfortunately, as you know, as time has transpired, we have had locals in some municipalities completely mandate pharmacy participation, and you know that has created a burden on our part, not being involved in that process, not being able to say, well, listen, we don't have the staffing capabilities to do this, or there is a significant public safety concern in this pharmacy, and there's no arena to have that dialogue. So we really do appreciate that, and I think that if the board chooses to support the motion that's on the table today, you know, the board will support this collaborative process which CRA and its members have been involved with for the counties that have moved in the direction for voluntary participation. So we thank you so much for that.
Thanks, Angie. Brian?
Good evening, Brian
Good
Warren.
evening.
With
Is
the
it evening?
I think so. Well, I guess we've got 4 minutes until 5. Brian Warren with the California Pharmacists Association. We too support the current motion. We appreciate the robust discussion today about protecting consumer safety, about this board being intent on ensuring that pharmacies make an independent decision of looking at their own pharmacy and determining whether or not they can safely host one of these collection receptacles. And I just, you know, want to remind everybody that it does not prevent pharmacies from collecting prescription drugs. This is intended to actually encourage it by establishing requirements that are 100% consistent with the DEA. There's actually, I think, a very high likelihood that many pharmacies will participate voluntarily when there are programs that establish funded mechanisms for this. in particular with the mailback envelopes. I think there was some questions about that. When there are programs like the extended producer responsibility programs that, that some folks have talked about today that pay for those envelopes, pharmacies will be very happy to give those out to patients. Pharmacies want to provide patients with options, but realizing that, like Dr. Weiser said, there are many independent pharmacies out there who have 400 or 500 square feet of space. You know, the behind the counter is much larger than what patients have, and there may be security reasons why you not be able to do that. So we do appreciate the board, you know, maintaining pharmacists' ability to determine whether or not they participate. We do think it's necessary to actually include this in there because of some of the local ordinances that have popped up, and just urge an aye vote.
You said include the voluntary. Is that what you're recommending?
Correct.
Okay. Thank you, Brian.
Thank
Hi,
you.
Mary.
Hi, I'm Mary Staples with the National Association of Chain Drug Stores. We too support the proposed amendment on the table that the board is considering. We believe it's consistent with federal law. We appreciate you addressing our concerns about after-hour security in that amendment, and we urge you to move forward on the 45-day comment period. Thank you.
Thank you.
Angie and Mary. So my focus is pharmacists, don't overregulate the pharmacists, don't overburden the pharmacists. We've talked about a recent a questionnaire that the pharmacists answered about the stress that they have, how overworked they feel, and the demands on them with regards to their profession that are non-patient issues. So here's one more, or one hopefully less demand that's a non-patient issue. I realize it's a public health issue. Providing quality care. And so it's my hope that the representatives of organizations with large numbers of pharmacists and pharmacies will hold that in mind and remind their organizations and their membership that the board is concerned about the interaction between the pharmacists and the patient when the patient gets their meds, and that's really my primary concern. So I wouldn't hesitate. I'd hate to miss the opportunity to mention that. Thank you.
Thanks, Stan.
No, thank you, Stan. And you know, we look forward to working with the board as well on that. I know that the survey that you're referencing is specific to some of the patient consultations, and you know, that's definitely a dialogue that we're having internally as well among our membership too, to try to raise that awareness and raise that compliance as well. So you know, happy to partner wherever we can.
Thank you, Angie.
Thank
Thanks,
you.
Mary.
Thank you for coming.
Hey, Stan, since when you learned to speak Chinese? I mean, finally you got my message, yeah. I mean, after 4 years. Well, I mean, personal experience is that, I mean.
Good evening.
Yeah, if it's voluntary, I have two pharmacies. One big pharmacy, I don't mind to put a bin in there. But my other pharmacy is so small, like you say, no room to put one, and you make me put one in there. At the same time, you know, as long as voluntary is, you know, not a burden paid for by the pharmacy, we don't mind having it in there. So I don't think we need to make it mandatory.
Good evening.
Hi there. Peter Kellis on behalf of Walgreens. Here, want to express their support for the amendment to the proposal here. We believe that voluntary makes sense. We appreciate the time that the board has spent on this very complicated issue. I know that it's been a lot of time, a lot of energy by all parties. The complications go from multiple levels, from the federal government to the state government, now to the local government. We appreciate just having some clarity, knowing what our charge will be, knowing how best we can serve our consumers and our patients. As the issue goes forward, it'll be interesting to see how the locals implement this when there's EPR applied, bearing in mind 88% of all prescription drugs dispensed are generics. They're very low cost. How does that apply as how these actually get funded and roll out? But we appreciate the board's time, effort, diligence, staff, members.
Does Walgreens have any pharmacies participating in Take Back, and if so, what's been your experience?
I understand that Walgreens has pharmacies that participate in voluntary take-back episodically in conjunction with local law enforcement. None, for example, are participating currently in San Francisco. What happens in San Francisco is that they provide written material to patients, directing them to the local law enforcement sites where they can dispose safely of the medications.
Do you have any pharmacies in any of the mandatory counties that are
I
participating?
do, and I do not have information as to how they are implementing it. They might not, I don't know if they're operational or not yet.
Thank you.
Hi, good evening. Lauren Burton with CVS Health, and I also wanted to come up and also offer my support for the motion that's on the table. CVS has also previously participated in drug take-back programs, specifically with the DEA drug take-back days and with local law enforcement. We also have a program called the Medication Disposal for Safer Community Programs, where local law enforcement can apply for and receive a drug take-back receptacle. We do have 15 of those receptacle units in California right now. We also provide consumer education on our website, and in our stores, we also offer the disposal envelopes to be sold. And for your question, Amy, around the mandatory counties, we do participate by using the envelopes, the mailback envelopes.
Thank you.
Hi, Don Gilbert representing Rite Aid. For all the reasons stated, Rite Aid also is supportive of the motion, believes that voluntary is the way to go. I do appreciate the very detailed discussion today. I just wanted to offer two quick things. One, I don't really think that preemption, I think it's an important issue to discuss, but I don't think it's really a concern. Every time you regulate, you preempt. It's nothing new. That's what every regulatory body in the state of California does, preempts, because the legislature delegated you, vested you with the authority to regulate the practice of pharmacy. I think it's more, I would have been more concerned if there had been a different motion with delegating that authority to another body that doesn't already have that authority. So I think this is, for those reasons, a very wise way to go, and appreciate the efforts of the board and staff.
Thank you. Any other public comment? Okay, we've got a motion, which I think was Debbie's, second by Victor, and basically it is to take this current regulation, add in the section regarding the after hours.
Right.
Send it to be noticed.
And send it for a 45-day comment period. Okay, all in favor? Abstention? Against? Okay, motion.
I would have liked to have made a comment before my vote, thank you.
You want to make a comment?
And put it back in front of the board, no. Yeah, I'm very concerned about the opioid diversion that's going on right now, the increasing death rate, the number of opioids that people are obtaining because they are not being, because they're out in the supply and they're not being returned, they're not being accounted for, and I think that we've taken a step in the direction of making it easier for people to get opioids.
Okay, Greg, we're moving on to board approved. Item C, nicotine replacement products.
Okay.
We're almost done.